Yeah, so it's an exciting time for acute myeloid leukemia therapies. We've had many years of slow movement in terms of improvement of patient outcomes and relatively few new drugs being approved compared to some of the other hematological cancers. But over the last 2 years or so, we've seen this almost an explosion in new drugs, both for younger patients who are fit for intensive treatment, but also older patients who are frailer and not so fit for intensive interventions. So we've got a range of new drugs that have been approved, first by the Food and Drug Administration in the US, but now we're starting to see some of those agents being approved by NICE for reimbursed use in the National Health Service. Of the drugs that have been approved, there are 3 that have now been approved by NICE for use in younger patients who are suitable for intensive treatment. One of those is called a FLT3 inhibitor called midostaurin, which can be added to intensive chemotherapy for patients who are newly diagnosed. About a third of patients with AML have FLT3 activating mutations, which most of them are associated with a less good long-term outcome. So for a number of years, the FLT3 inhibitors have been under development, and now midostaurin, which is one of the first generation of drugs, has been approved following the results of an international study called RATIFY, where it showed that there were improvements in overall survival across the spectrum of different FLT3 mutations. The second new drug which has been approved for intensive treatment is called Myeloid, and that's an antibody-based chemotherapy conjugate that a number of the international groups, particularly the UK NCRI group, has been testing in newly diagnosed patients for many years. And as the results of these cooperative studies throughout Europe and the US, Myeloid has now been approved for use in combination with chemotherapy for intensively treated patients right across all of the different cytogenetic risk groups, apart from patients who are known to have adverse risk mutations. The third drug, which has been approved, is called Vyxeos, or to give it its original name, CPX351, and that's a liposomal formulation of 2 traditional chemotherapy drugs, daunorubicin and cytarabine, which, following an international phase 3 study, has shown improved outcomes in the opposite group of patients to Myeloid, the patients with adverse risk cytogenetics, and particularly those with therapy-related leukemias or leukemias that have followed a preceding myelodysplastic syndrome. So really across the spectrum of intensively treated patients, one or other of these drugs can now be offered routinely.